Welcome to Planetary Health First, Mars Next. It is going to be an amazing journey today. Hope you are ready for liftoff. We are live now. Well, welcome to Planetary Health First, Mars Next. I am Michael, the host. It's so awesome to have you here, to have you join us. We have a special guest, Anang, and he has done some amazing work in physical therapy. He has worked and led startups. In fact, he's probably one of the first with the remote patient monitoring or remote CRV, some of those codes, excuse me. So anyway, Anang, if you want to go ahead and start and share with our audience a little more about you, please do.
No, thanks, Michael. Thanks for having me here. My name is Anang Chokshi. I'm a physical therapist by trade. I've been in the digital healthcare space for almost 12 years now. Kind of left traditional care 12 years ago, and to help found and start a company called Reflection Health where we're trying to digitize physical therapy using, at that time, the Microsoft Kinect camera. And so when it first came out, I had a couple of founders of the company who were looking at the camera and said, hey, how can we use this in a way to understand what patients are doing at home in terms of their physical therapy. So was with that company from its inception to it got acquired, went into consulting a little bit during the pandemic, and then, joined another company in the similar space, but back to consulting where I can kind of help startups from all the learnings I've done over the years and some of the things that have worked and probably more of the things that haven't worked, right? And then in terms of how to work at it that way, and how to talk to the market and how to kind of go through that product strategy development as well.
Excellent. Well, I'm glad you're here. I'm glad you said yes.
Yeah, thank you. Thanks for having me. I appreciate it. I'm looking forward.
Well, we are going to touch a lot of things. Hopefully we go on a tangent. Hopefully we go down one rabbit hole and come back, but we might even just take a wormhole, hyperloop to Mars. Who knows, but we'll come back.
Yeah.
And so some of the more of the thing is MSK. We're going to touch digital health, remote patient monitoring. And from your perspective, you're going to really drive a better understanding. So where should we start on this conversation?
I think it's always, good to understand, what is remote patient monitoring, or what is remote therapeutic monitoring, right? Like I also say too, is like, the threat of digital care, right? How a lot of clinicians sometimes feel threatened by it. I think, when you think about digital care, or technology as part of your care continuum and offering as part of your service, my instinct to say just not to be threatened by it, right? This is just something that we're gonna have to do to kind of supplement what we're doing in the clinic, because it becomes really important that to understand what patients are doing, not only when you're in the clinic, but what they're doing when they're outside of the clinic, right? Because again, it's the same thing that we always used to use. Everyone uses it in the clinical space, especially in the PT space. Like, Michael, I see you 2 or 3 times a week. 99% of the time on your own. So what you do at home is important, but understanding what you're doing or interacting with you in between those visits become really important as a holistic kind of environment to provide the care for that person.
So Anang, what is the number one thing that's stopping huge adoption with RPM?
Yeah, that's a great question. When it comes to remote kind of patient monitoring or therapeutic monitoring, it's really, I think obviously the first thing is reimbursement, right? I think reimbursement is part of the issue, where again we are driven by a fee-for-service world. We always talk about value-based care, self-insured employer contracts to work in that case rate. That's there, but it's again not widely used. 90-95% of the cases that we see in the clinic are insurance-based. So RTM, remote therapeutic monitoring, those codes came out in January of 2022. Remote patient monitoring has been around since I think 18 or 19, so they've been around for a few more years. Remote patient monitoring is more about the physiological parameters, and remote therapeutic monitoring is more based on the kind of the non-physiological parameters and the prescription to that. And so, you know, because clinicians aren't incentivized to really clinicians are incentivized, right, to see people more often and to build codes. And when you try to involve digital care, it's changing the workflow of the clinic. And as we all know in everything, when you change the workflow of any type of any profession whatsoever, there's hiccups, there's learnings to happen, and it takes a little time. And I think we're in that early infant stage when it comes to remote patient therapeutic monitoring in the physical therapy or the MSK space. We're still early in that because we have to realize how to do that more effectively, right? And to do that in a way that's also profitable and financially stable for the organization too.
It seems like it's such a difficult thing with the I'm hearing reimbursement, but it's not really reimbursement. It's just as much workflow and all those factors. Like, how much would the reimbursement? Would there be one per? So it's going to be really exciting. The little points in between. What do you think? There's points that could maybe accelerate this, or these happenings that need to happen.
Yeah, I think like you said, reimbursement is part of it. I think it's to me, and like you just said too, it's really the workflow. I think in order to really, I think, adopt this or really engage this and to really be successful in this, there's going to be some options. There's going to be some options where you have to create new positions within the clinic, within the organization to help manage these patients and do more population health management of people more than transactional healthcare with people. And so I think that's a big thing. So being able to create new positions, create new ways to have clinicians manage these people, because right now, you can't add another thing for a clinician in the clinic to do, because the clinicians are already overburdened, have a lot to do, are over and are busy with their schedule, and to now ask them to manage people at home on top of that, it's just not honestly feasible or possible, right?
Anang, so
Yeah.
you're doing a lot of consulting now in this. Can you sort of share a little more of the day-to-day kind of the challenges that you're
Yeah.
seeing?
Yeah. The challenge when it comes to this, the challenge is, when it comes for adopting it, is really workflow. That's the primary number one thing, right? And number one, and number two is it's also kind of aligning on the value to the different stakeholders in this workflow, right? Because there's a value for the patient, there's a value to the clinician, and there's also obviously there's a value to the organization, right? But the values aren't always the same, right? The value to the clinician might be more just a better therapeutic alliance with the patient, better ability to drive better clinical decision making and driving patient satisfaction, versus the value prop for the organization is most likely going to be deemed around potentially around maybe utilization, maybe more revenue driving, and that. So where and potentially being more efficient with the care with in terms of managing the number of patients that a clinician can see, and so. That's always is the kind of the challenge. And the biggest challenge is workflow, because if you add, again, like I said, more things to more people, they're just not going to get it done. It's figuring out this new way. So this is where I not only do I work with digital healthcare companies, but I also work with organizations in terms of how do you adopt technology within your practice? How do you implement it? How do you use it? And how do you evaluate the 10, 50, whatever, the dozens of companies that are knocking on your door every day?
So who is that person is it the CFO, the C-suite, the practice owner of a few
Yeah.
physical therapy?
You
Sorry.
know, yeah, no. That's a great question. I think it's changed. Honestly, it's changed. So when I started this 10 years ago, when we started in this world, we would probably reach out to the VP of rehab in a hospital setting or a rehab hospital, or you're talking about even when it came into the physical therapy clinics, you're probably going to read more to the directors and the C-suite level. I think when you think about this more, it's more or less now it's rehab is a part of the care, right? It's really more MSK care. So you have to go a little bit upstream sometimes. So if you're talking to, let's say, hospitals, I think most likely you're going to want to talk to people who are in either the service line level, service design level, right? The head of the MSK orthopedic section, not really, and then have rehab involved, but not maybe directly rehab, because rehab is downstream of where this MSK occurs, right? MSK is a little bit high upstream, so you have to go a little bit upstream. But if you're talking about in the PT clinics, it's probably more your chief operating officers. They have new positions now called digital health and transformation and information innovation officers. So those are the people that you start with the conversation, or your rehab directors as well.
So when you like see 2024, what do you see? Do you see anything different, or do we need 3 years out?
Yeah, I think it's a slow evolution, right? So I'm more the 3 years out. But what I do see coming in 2024, right? These RTM codes, which is the kind of the sister codes of the RPM codes that started in January 2022. There was a conference earlier this year where they asked a bunch of, I think there was 40 or 50 PT practices there, and they asked how many people are doing RTM, remote therapeutic monitoring. 2 out of the 40 or 50 people put their hands up. Then they asked how many people are interested in doing it. That number was almost 100%, or 90 to 100% of the people put their hands up. So people know that this is here. People, I think, were a little bit reluctant at first to make sure, is this real? Is this actually going to show some value? Is there value to this? They didn't want to jump into this too soon and then have Medicare pull these codes back and say, no, we're not going to do it anymore. Now that these codes are kind of, they appear to be here and going to be here for a very long time. Now organizations are looking. So I see 2024 as the year of pilots, right? A year of people kind of dipping their toe into this, understanding how to do this more effectively and efficiently, how to help patients not only in the clinic as they already do, but now outside of the clinic. And then I see, kind of 2-3 years down the road, it's like, how do you take this model of care now and apply it to different things, not just additional patient remote therapeutic monitoring, but now not even calling it remote therapy, but just saying, hey, how can I provide better holistic care to people? And how can I value that, or put that a dollar figure on that, and maybe work in a value-based care or initiative, case rates, self-assured employers, or even cash-based businesses, right? Where you're kind of delivering concierge physical therapy to the person, right? That's where I see it going in the next couple of years.
I like that. I'm seeing little slots, the little slot machine, slot spots, and
That's
then
right.
the slot for that value base. So they're going to have different levels of what the service is and how much it costs and the value. I'm seeing that in a lot of pilots. So if you were to start your own company, you've been a startup, you've been co-founders, you've been at multiple levels, but if you were to start one in 2024, what would that look like? Or if you were to advise a company?
Yeah, to me, it's really it's really understanding, because there's so many companies out there now that are claiming to do the same thing, right? And when I want to look at this, it's obviously this patient management solutions that are out there. But when I think about it, is how can I help organizations be more effective and efficient in the clinic, right? Because clinicians are overwhelmed. There's a problem, at least in the physical, in many different levels of healthcare. But I know in the physical therapy world, where clinicians are just burnt out and are having, being pushed to see more patients and all that. So how can we help them be more effective and more efficient in the clinic? Can it be, note-taking solutions? Can it be helping them with auto documentation? Can it help with maybe using computer vision to streamline the evaluation and progress reporting process within the clinic, right? And which kind of goes to this remote monitoring part as well. How can you help them be more effective and efficient in not only helping patients and treating patients, but also managing them, right? That's the big thing, because that's where a lot of the mental stress goes, is like the management of it. Okay, hey, Michael fell off my schedule. Michael hasn't been in here a couple of days. How do I make sure that Michael's continuously engaged, right? so that he gets better. But at the same time, making sure that I am providing enough feedback to Michael to keep him engaged as well.
So with the writing and the note taking, do PTs spend the same amount of time as a
Oh
clinician,
yeah.
a doc?
Oh yeah, yeah, yeah. So we see the patient, 2 or 3 times a week. So we're doing notes, those SOAP notes 2 or 3 times a week, plus our initial evaluation, our progress reports, discharge reports, then utilization review reports, right? Again, so we're in that world the whole time. So how can we make this experience more effective and efficient for that clinician, where we can auto-populate some of these areas of the notes, right? Where you just have to kind of approve it, right? I think
All
that's
right,
yeah,
Angad,
yeah,
I'm sending it out there to the audience today. If you're a startup, really AI, if you're doing some really super thing, I see an opportunity. Reach out to Angad about starting your startup that's going to be AI that allows all the notes to be taken in real time, right?
yeah. I like it, right? I know there's a number of organizations out there all trying it, and I think that's the way to do it. Like, how can you capture this without me having to put minimal effort into it,
Would
right?
that be a good idea or a bad idea? An AI empowered therapy note taker?
I think it's a wonderful idea. I think there's a lot of companies. There's many companies. I think it was what's it called? I'm just drawing the name blank. Someone was acquired by Microsoft just recently.
Oh, I know.
Uh,
I think was it. Yeah, I know what you're talking
I know,
about.
I know. I just draw. It's like Validance, or I forget the
Yeah,
name of it right now. But again, I think it's out there. That I think
yeah.
it's not a new thing, right? But I think
Mhm.
I see a lot of this becoming a part of EMRs in the future, very near future, right? Where there's going to be ways to auto populate EMRs notes in a more effective and efficient way, with clinically relevant documentation that doesn't have to be uh, dictated anymore or typed anymore like we used to do back in the day.
So tell us something about yourself.
So let's see about myself. I'm originally from Nova Scotia in Canada, East Coast in Canada. Went to school at McGill University and did my physical therapy at University of Michigan Flint. Now I live in San Diego, and kind of slowly made my way southwest, excuse me. So almost from the furthest eastern point of Canada in Cape Breton, Nova Scotia, Sydney, Nova Scotia, to all the way down here in San Diego, California.
Well, you
So
had to pick a tough place to live.
so it's funny. I kind of moved down here slowly over time, and one of my moved to LA, and then a job pulled me down to San Diego, and I thought, oh yeah, I'm in California for a few years, but not that long. But met my wife, have 3 kids in San
Cool.
Diego. Now I'm stuck
That's
in a
where I
good way.
met.
In a good
Hey,
way.
that's where I met my wife. I lived in
Oh,
San Diego,
oh
so
no
I
way.
know 858 and
That's
six
right.
one six one
Six one
nine.
nine. There you
Yeah,
go. That's right. That's right. That's it. That's
yeah.
awesome.
Tried to surf for a little bit, but now I do my
That's
surfing in Virginia Beach on a little longer board.
Oh well. That's one thing I don't do. I don't do surfing. I don't. That's it. So I'm
Yeah.
play a little ice hockey and tennis. That's my big thing these
Cool,
days.
cool. Have you taken up pickleball yet?
I have. I did take pickleball up. I took pickleball up during the pandemic, and I was one of those statistics where a couple of years later, I tore my meniscus and had knee surgery, and now I haven't gone back. I'm
Yeah.
playing tennis instead. So
Cool, cool.
yeah,
Both
a
of
little
them are
gunshot.
great. I played tennis. I played pickleball too. So,
It's a great game.
yeah, no, that's awesome. So,
Mm.
with that being said, what is the vibe? Is there anything you're picking up from San Diego with the kind of startup and the healthcare, sort of anything in that area?
I think San Diego is still is really big in the biotech, right, with the
Hmm.
Qualcomms of the world and everything down here. I think there's a lot of I think the opportunities are a little bit different than it was before. I think the startup world is still there. It's not. It used to be so connected and everything back in the day. I don't feel that as much, to be honest with you. Right? I'm not as well, I guess, integrated into that as I was before. But I don't see that happening as much. I think there's other cities around the country. I think I was at Austin for a conference the other day, and I walked around Austin, and I was like, this feels like San Diego 10 years ago, right? Just where
Mhm.
there's a lot of groups and gatherings related to startups to connect people together, happening on a weekly basis, right, or monthly basis. Um, that happens here in San Diego, but not as frequently as it used to.
Mhm.
Yeah.
Yeah, there is something going on in Austin. There's a
Yes,
really cool vibe.
there is. Yeah, it's just I think it's a good food, right?
Mhm.
And a fun downtown area. And I think people are just looking for people are kind of gravitating towards that, right? And
Mhm.
looking for new places to just kind of set up shop.
It's like an emerging city, and I mean, it's there's been many years that it's been growing, but it just kind of flowered, it bloomed.
Yeah, no, for sure. I think it's Austin is a great city, and I think San Diego is still a wonderful city and has a great opportunities out here as well.
So, Anga, what do you have on the radar? You said something about a conference? Are you doing any conferences coming up this year, 2024?
Yeah, in the PT space, the big conferences are always the combined sections meeting of the physical therapy back down up in February, and then the good ones where you see a lot of the APTAs now becoming setting up these great conferences in the summertime of kind of bringing innovation to the forefront for physical therapy. So there's a couple of leaders in the APTA space who are really pushing forward and creating, helping digital healthcare companies um, become more kind of recognized by the physical therapy world. And so there's a conference in July, is an APTA event in July that happens as well. And then the big one that I thoroughly enjoy is the private practice meeting in November for the APTA, because that's where a lot of the physical therapy large private practice clinics come together, and that's where you see a lot of the not only the leaders but innovation and how people are using technology to better their experiences and better the care for their clinicians as well as patients.
And how often do you go to that? Has it been many years you've been doing that?
CSM, I've been going for many years. I'd be PPS. I've gone to it the last couple of years, and I've been blown. The first time I attended, I was just blown away by it personally. This APT event is a new one. I think next year will be its second annual event, and it's a growing event as well. And I think it's growing. There's a increasing kind of need for that in this space.
So, what are you excited about?
I'm excited in the space of, I'm seeing more clinicians open to the idea of using technology as part of their practice. I've been fighting that battle for the last 12 years where, you talk to clinicians about technology as part of practice, and they were saying, well, is this going to replace me? Is this going to do this to me? Am I going to have a job? I used to kind of guest lecture at universities in the PT space, in the PT departments. And I remember one university I would go to and talk about telehealth, and they're like, well, is it legal? Is it even allowed? But
Jeez.
this is back in the day. And I'm like, and these are the professors asking me this and challenging me on this, not even the students, right? And I was like, just had to educate them, right, at the world. And now obviously this pre-pandemic, and now to see since the pandemic, the openness to it, and now seeing even
Mhm.
more to it, where we're seeing a large number of people in the physical therapy world who are moving into this digital healthcare space, and we're seeing people adopting technology as part of their practice to deliver hybrid model care. And to me, that's a big thing for me. I think hybrid model care is the next thing. It's not all in person. It's not all virtual. It's what's the best type of care for that person, right? What does that person need at this particular time? And so this is where seeing clinicians being more open to adopt technology as part of their workflow, and to using the data that's coming from that as part of their everyday clinical decision making. That's what really excites me.
I like this hybrid.
Yeah, it makes sense, right? I think it's really the way that we have to think about it. I would go back to the word we used earlier. I think we may talk about concierge care, right? It's about delivering the type of care that a person needs. There's a lot of, you know, great organizations out there that are using technology that are also even delivering in-home therapy as well as part of that, right? And now, how can you use technology to manage that person again when you're not with them? and then deliver care wherever they are, in the home, in the office, wherever they may need it.
Do,
To
do you
again
think
to do it.
is it fear that's motivating these adopters? What is it that's motivating them?
That's a great question. I think fear is I don't know if it's fear. I think it's them being more, just realizing how technology can help them do what they want to do, right? Meaning, you got into the world of physical therapy to help people. How can I really truly help people? That's one of the reasons why I left traditional care years ago, because I could help the people who are under my care. How can I help even more people with technology? How can I help other tech? This is why I got into consulting. How can I help more companies help more people? So you're expanding your reach to have your influence over more things. And I think when clinicians adopting it, I think it's two things. One is they're burnt out by the traditional way of doing things, right? Because they don't feel like they can provide the type of care that they wanted to when they try to get into the world of the idea of when they were going into the world of physical therapy. So they're seeing a way, how can I augment that in-person care with some digital kind of touch points in between it? And then I think, at the same time, it gives them some flexibility, right? Rather than being in the clinic 9 to 5, or I used to be in the clinic 7 to 7, right? 4 days a week, right? And it's like, okay, well, now I have some flexibility. Maybe I can do some in-person care in the morning and do some virtual care in the afternoon, or the ability to change it up a little bit, right?
Mm-hmm.
And kind of, bring healthcare to the into the more kind of the 21st century, right? And more modern, where now you're basically, what you're doing, you're doing something what's very similar to what's happening in rest of the economies out there, right? Where you're now having that gig economy type of lifestyle.
So I know there's some big telehealth providers, but I'm just thinking, as a small practice, that one, I imagine there's a huge incentive, because they don't want to, they like the consumers here. The consumer does not want to go in for a visit, and they have to do that. The younger the patients, they want just care right here. Seems like that would be a driver if you're like 40 in the practice of PT.
Yeah. I think definitely there's it. I think there's physical therapy is still is a very much needed profession, and there's a high demand for it. And so, not only you talk about the convenience you can provide by using that, as a consumer of anything, what do you really value the most? Is your time and your convenience, right?
Mm-hmm.
And so, so as a consumer, yes, it makes it more convenient. But at the same time, with all these wait times and longer wait times to get in to see doctors, right?
Mm-hmm.
I have a PPO here in San Diego, and I try to create a start of care with a family practice, a family physician. The earliest appointment, this is back in October, was January, right?
Mm-hmm.
And so it's becoming more difficult now to get in and have these appointments. So how can you triage this a little bit? Identify who really needs to come in, who doesn't, and who may, right? Because again, in-person care is needed. I'm never going to say that in-person care is needed, but maybe in-person care may not be needed as often for every single person, and maybe it's needed more often for certain people.
I'm just imagining something right now, like this imaginary digital disruptor that's going around just taking hospitals and this and that services lines and just hacking away right now, as the consumer's just hungry, and that's happening. And those are what you call digital health, right? Digital health. It's just,
Well, listen, it's going to happen if we don't innovate ourselves as clinicians. There's someone's going to come into the industry as a competitor and innovate in a different way, and start going and providing kind of, wellness or other things that are kind of in that same realm, right? And doing it direct to consumer, and providing that kind of all inclusive 360 support of that patient. All these things, right? And so I think, as clinicians, as healthcare providers, healthcare clinicians, and doctors, and physical therapists, nurse practitioners, we had to evolve a little bit and understand that, how can we make it more? Why do we always think people want to come see us? How can we make it more convenient for them? almost like that whole bringing back that old kind of the doctor visit to the home type of idea.
I want to
Yeah.
bring up the thing that you said earlier, which almost sounded ludicrous, but it's really spot on when you think about preventing disruption with regulation. The fact that they were like, is it legal with telehealth? And you got to think about it like, interstate commerce, state to state, the scalability, and Amazon would love to just wipe out, so talk
Yeah,
about that.
yeah. No, when it comes to all this, as much as you want to expand this and do this nationally, you have to follow the regulations. Each state has a different regulation. I myself, as a physical therapist, can only treat patients in the states in which I'm licensed, right? So that means, if Michael, if you're in Virginia, if I'm not licensed in Virginia, I cannot treat you in Virginia via physical therapy, right? I would have to be licensed in Virginia, and then even though I'm in California, I can still treat you. That's no problem, And so that all this mental, and then not only that, they have something called the compact, right? Legal compact, where it allows certain states will allow you to kind of get reciprocity into another state very easily. Some states have compact, many states, California does not. And so what
Mhm.
that means, by being a resident of California, if I want to work or have a work or want to see patients in any other state, I have to get licensed in each of those individual states one by one by one, and then manage my continuing education of those patients of that license for each of those states independently. Versus if I was part of live in a compact state such as North Carolina, I could just only focus on my North Carolina, pay some dues for the reciprocity states. But in terms of continuing education, I might primarily just focus on my home stage education. So the complexity of the legal issues and regulatory stuff also makes this a little bit of complicated. And then
Yeah.
also when it comes to some of the different rules or laws of ownership of physical therapy
Mhm.
clinics or
Yeah.
networks, right? As well, medical
Anang,
practice.
I feel like you're bringing up a really challenge. The biggest challenge we have in healthcare with the regulation, that it's just not to the consumer's benefit. There's
Yeah.
just so many things that are so uh, just
Yep.
ineffective, and it's only in America that we create this. It does almost not sound legal.
Yeah, it makes I get it. I understand it. It's there to protect the consumer and the patient. I get that, but it does at times affect innovation, right? And affects the
Mhm.
way to kind of challenge the status quo, right?
But
And
it but
define new
it's
models.
but it's so hard. So where do you get to with the regulators? You don't want to, it's but it's necessary. We need to reframe healthcare, and I don't know. I mean, you can just take line by line, just the amount of insurance premium. I
Yeah.
mean,
Oh, yeah. No, well, I agree with you. Listen, I'm a Canadian, and I remember my
oh,
first,
okay.
yeah, right. So I remember my first experience with U.S. healthcare was when my first daughter was born, and we had a PPO insurance and went to UCLA Healthcare in Santa Monica and went in for it. I guess UCLA Healthcare and Blue Cross Blue Shield of California a couple of months before had a little bit of an issue and disagreement, and so it was out of network, but they gave us a continuous of care because we were late in my wife's pregnancy, and then we got this massive bill after my daughter was born, and I was like, it was like $60,000. I'm like, how can anyone
Mm,
afford to have a child in this country? Told my wife, I was like, if I knew this, we were 2 months earlier, we were in Canada. We would have stayed in Canada and delivered for free and everything like that.
mhm,
It's just, it's daunting. It's daunting. It's
mhm,
scary where you're paying for the fear of getting injured or getting hurt. Right.
mhm.
So at
Yeah,
times.
I feel like there could be a real simple catastrophic policy out there. Not an A, B, C, D. I don't need any of them,
That's right.
you know?
Right. That's right. Yeah. There has to be a way to that, where there's something there to protect you when something does go bad, but the lower level stuff, right? It just has to be the wellness program,
Yeah.
the general wellness stuff. Just preventative stuff should happen. should be part of
I
it.
don't know where, if it was real or spoof, but I saw a policy where it was some policy, but it was $15,000 deductible, but a zero premium. Zero premium, but you had a $15,000 deductible.
It's interesting, right? It's like, it makes you question, like, okay, well, yeah, what's going to happen, right? Because again, premiums, as a family, I'm paying over a couple of grand of premium a month. So, and so it's like, okay, that's $24,000 a year out of pocket, just gone. Right. And so it's tough.
And I don't see how that's legal. I don't want to sound like a
Yeah.
libertarian, but it's like taxation without representation. How about stealing all my, I guess you sign up, but
Yeah.
what is the other choice, but
That's right.
it goes right out of your paycheck, every whatever.
That's right. You don't need, money doesn't even exist, right? It's just,
Yeah.
it's just there. It's come and gone.
There should be what I think we mandate a law. It's called a 1-for-1 match, and people will be able to retire in 50. in 10 years, people will be able to retire. You take the money that you pay for your health care, and you'll have, whatever, even a whatever. I mean, just match it for the our entitlement programs. Match it at a fraction.
It's tough, right? Because it's getting even it's hard for businesses to even do that and to offer it, right? And so it's becoming really tough, and that's why I think, when it comes to even physical therapy clinics, when you think about this, they're going to have to think about innovative models, right? Because people's deductibles are higher, so people are really paying out of cash, right, out of pocket. So maybe there's different models of care that they're going to have to start looking into, rather than thinking of the traditional fee for service. Maybe it is a cash-based model where you're selling packages. You're saying, hey, Michael, you know what? I'm going to treat you in for a 2-month package that includes virtual consults and in-person care and a digital kind of connection. It's going to be X amount of dollars per month, right? And you apply that to your deductible. That's the type of care. So now you're kind of getting in that population management again. And you're being focused more on outcomes and goals and satisfaction.
I do think that the reality is we will see, we got the underserved Medicaid, but really the average person wants, and everyone wants to dictate, have agency. But, there's a point where what is health? It's like with the way it is here, it's sick care, but people, need to have more ability to control how they want to encounter the care and not be on the other side with insurance. So I really see at some point the insurance knows this, their actuary data, but there is a delicate a balancing point in digital health startups or those intermediaries.
Agree with that. I think there's a way now. I like the way you said that. I think these. The traditional way of you're dealing with a sick person. How do you even manage or help that person before they're sick? How do you prevent them from, helping the cholesterol level, whatever it is, or just help them live healthier lives before that? Because the goal of all we're trying to do as in general is removing barriers to help people live happy and healthy lives, right? And to spread that impact over many lives as you can. That's the point of technology. But now, how can you help people before they get hurt? Because again, when it comes to physical therapy, I think there's a large number of people who still don't understand what physical therapy is and how it can help them. But everyone knows that the value and the importance of walking.
I will tell you, I'll tell you firsthand. I had back issues. The doc could not diagnose me. I went to a physical therapist, paid out of pocket, I don't think more than $80, $90. And within 7 minutes, he gave me a diagnosis by physically examining me and having me do the stuff. And it was really frustrating. So I think our health, and nothing against the clinician, I wouldn't mention his name. That's not, I don't need to whatever Yelp. I mean, but my point is, I think they're burdened. He couldn't do he just, their knee-jerk reaction was to have, do an MRI or X-ray. But reality is MSK. Tell me about that. I mean, most of us, if you're older, 45 or whatever, we all are having back issues. We're having Tell
That's
me
right.
about the prevalence of that and
Yeah, the apparently, 50% of all people have some type of back problem. Not only that, 80% of all low back pain will resolve in 6 weeks as well, right? We know that. So, again, what we're trying to do, again, is not, you want to educate people on how to manage it. That's what it is. How to manage it, what to do. Because sometimes what we do in physical therapy and other things, I think when I think of physical therapy, myself, the reason I got into it is because of the teaching part. I love to teach, love to help, and so I'm a big, I went through this orthopedic residencies and sports fellowships and all that stuff. But I'm a strong believer in the psychosocial component of physical therapy, the education part of physical therapy, right? Understanding that, hey, Michael has a back pain. Hey, Michael, how are you sleeping? How are you getting in and out of the car? How are you doing? How are you brushing your teeth in the morning? Because all those things excuse me, will affect your back pain. It's not just go back and do these exercises only. It's all the other things, sleeping, nutrition, meditation, right? All those things can apply to it.
Mhm.
And help with that, right? And I think you got to really look at the holistic approach to the patient more than just kind of, again, your special little field of, oh, okay, MRIs, X-rays, opioids, whatever it may be. There are other ways to help it. Acupuncture, chiropractic, whatever may help, right, is important.
Mhm. Anang, I'm glad we had you on this show today. I'm really glad you came on.
No, thank you so much. I really appreciate it. It was great to kind of talk to you and connect and talk about this. Love this topic, and I think there's an impeding impact that's still coming from this digital healthcare.
Well, we're not finished yet. We're still talking. And did you have any idea what we were going to talk about?
Not really, actually. That's why I like it. This is just a kind of a sitting down and relaxing. Let's just have a conversation. That's what I
Is this
enjoy.
scripted?
It's not scripted.
It,
No, that's right. It is not scripted. So
we're
which is
just
great.
we're hanging out. I don't know if we're on Mars. Where are we?
We're somewhere. I think somewhere in
Yeah.
between, right? So just kind of floating there in space and time.
You
Yeah.
already told the audience. You didn't give them your coordinates, whatever,
Yeah.
but you're in San Diego. Whether
But
you're
I am
there,
in San Diego. That's right.
yeah.
That's right. So
And
yeah.
so but right now we're connected on Planetary Health first, Mars next, and this is an awesome time. What is something we can then go to as we've kind of gone through different rabbit holes, conversations? Where can we go now, Anand?
Yeah. Let's see. I think, for me, it's really about, um, I think the journey. It's always about the journey, the patient journey, and the journeys of people, right? I think it's understanding what experience have they had in their past that's kind of made them what they are today, and helping them shape the future as well. So, to me, I love to learn, more about you, Michael. Like, what's your journey? How did you get to this? Why did you start even the podcast?
Yeah, no, great question. I think I have this intrinsic desire to learn,
Mhm.
and I guess I'm an autodidactic learner, whatever. I learn by doing, and so I just really thoroughly appreciate having people like yourself on where we can just sit down and talk. And I think it's the social element. There's a desire to connect, just to connect,
Yeah.
and I think there's nothing better than having a conversation and listening to someone. The fact that I now know, I'm still kind of in shock. Do you really like hockey? I think I heard ice hockey. I know tennis. I know and then
Yeah.
pickleball, but pickleball I will not ever talk about
Yeah,
again.
that's right. Yeah, pickleball and a little gun shy. You might see me duck if I hear about pickleball. I'm a sports fanatic. I love the sports. That's why I think, movement, sports, science, and education. That's why I got into PT, because it kind of encapsulates all the things that I've enjoyed in my life. And so I'm a sports nut. Sports nut. I'm a
Yeah,
memorabilia nut. Love to buy. I'm
yeah.
a big memorabilia guy as well.
And I just think when I think of you as PT, I think of my father who's 91. He's on
Yeah.
hospice. He's
Yeah.
had a wonderful life, but my mom who's 85. But PTs have been really next to their primary care doctor. Those really for my dad, more so for my dad, have been instrumental to his quality of life.
Yeah. I think people who get into physical therapy they're really getting into it for I think the intrinsic value of just helping people, right? And that's the reason they're getting it. It's not a financial reward per se or anything like that. It's really more about helping people return and live like we talked about earlier, that having removing the barriers for a healthier living, or just being able, like you said, get back to the game of life as much as they can,
Mhm.
right? Um, I think you'll notice that with any physical therapist, they tend to be people persons, right?
Mhm.
They want to just be there to help and there to support as much as they can.
Anang, so what should we do? How should people get you, find you? What do you want to tell us about you? I mean, this is your we're here. Tell us.
No, I appreciate that. Again, love. Hey, anyone who has looking to get into the world of digital healthcare as a clinician, always happy to talk to people, talk about my journey, talk about what they're doing, and giving them advice at the same time. But again, if there's any companies out there that are looking to, again, looking to kind of help with their go-to-market strategy or product development, or organizations that in the healthcare world that are looking to bring in technology and need someone to evaluate and do some due diligence. This is my bread and butter. I've been living it for 12 years, know a lot about the industry, know what's real, what isn't, and what's good and what's bad, and what's working and what isn't. And so love to just have a conversation, just like we just had now. Just hit me up on LinkedIn. I'm always there. And respond, send me a message, and we'll connect and we'll have a conversation.
Thank you, Anang.
Yeah, no problem. Thank you.
Friends, it has been a great journey today on Planetary Health First, Mars Next. Follow us for more on Planetary Health First, Mars Next. Until next time, peace be with you.